At this point in the pandemic, governments are looking for any way to get more supply of vaccine or to make the supply they've got go further. Well, to stretch what it has, Quebec is changing how many doses some people are given. The province's public health director says if someone has already had COVID-19 and recovered, they don't need a second dose. Now, both Pfizer and Moderna call for 2 doses of their vaccines, a first shot and then a booster. But there are now studies that say someone who's recovered from the novel coronavirus already has antibodies, and that first shot acts as a booster.
I'm surprised people haven't moved to this faster.
Infectious diseases expert Dr. Zain Chagla says the studies so far have been quite clear. In fact, they've shown people who've had COVID-19 actually have more antibodies after 1 shot than someone who's never had COVID-19 but who's had 2 shots. As a way of stretching supplies, not giving people a shot they don't need makes more than a little sense.
It's an easy win to save doses if we go forward with the strategy.
Now, governments around the world have been cautious about fiddling with the vaccine companies' protocols, but Quebec's not the first. Italy announced earlier this month it would be going with a single dose for recovered patients. France and Spain did the same in February. Could other Canadian provinces follow suit? Well, Manitoba said Wednesday it's waiting for more information.
The data right now is still early and there's not very much of it yet.
There are some questions Quebec still hasn't answered. If someone recovered, say, 6 months ago, would they still have enough antibodies? If someone had a mild case, would they have enough? Some of that's still being worked out. Quebec also hasn't said how many doses it thinks it might save, but in a province that's had more than 300,000 cases, it could be substantial. Mike Armstrong, Global News, Montreal.